So we were just talking about carrying things, and you were mentioning how you prefer to carry things.
Yes.
Yeah. Would you like to just talk about that?
Yes, well I find that if I'm carrying it like this, it's actually a bit of a strain, more of a strain on my shoulders and potentially elbows. So if I tend to do it like this, I tend to use bags like that full time. And because I've got scoliosis, if I ride it on the left, I might straighten up a bit. So yeah, that's right. And I can't think that I'd use it any other way.
And that way you're protecting your hand joints,
Yes.
your elbow joint, even your shoulder joint, because you've got it a little bit more proximal than your shoulder joint.
Not all the way up to the neck, but
No.
just here, just comfortably there.
Comfort is the key.
Yes.
And the other thing you were mentioning is that in terms of how much you'd carry, you would be thinking about how heavy the load was. That's important, isn't it?
Well, things like dishwashing, big dishwashing detergents and cat litter, things like that, I don't want to carry.
No.
I don't want to carry them. I mean, I could probably carry it like that, but I don't want to.
No, I understand that. And a lot of people tell me, particularly I suppose since all of our experience with the pandemic, more and more people went to getting things delivered.
Yeah.
There are some things that all of us might think, well, you know what, that's a very heavy thing. Maybe I'll bulk order that and get it delivered.
Yeah.
People make their judgments on that. I've certainly, over the last few years, speaking to my patients at Walper, people have really thought out what's best for them and how they can use what's available to meet their needs.
Yes, exactly. And I mean, the other thing is that maybe you're better off with 2 bags that aren't too heavy as well. But as a general rule, I'm never going to be carrying a really heavy bag around.
Would you ever consider using a trolley that you pulled along?
I'm fortunate I just live over the road from the shops.
Perfect.
So no trolley.
No trolley, no need.
No trolley, no.
That's great. I often advise people to think carefully about where they position things so that when they come to lift them up or need them, they're in a more accessible position. So I think if we think of that Goldilocks zone being between our hips and our eyes, anything that's in that range is of course much easier for most people to reach and access. If something's down on the floor, it really depends on what you can do, again, what you can do on the day, as to whether you're going to be able to get down to that particular thing or whether you need to bring it up towards you. One way of bringing the thing up towards you is to use a hooked device, and if the thing has handles, then what you might do is actually face the thing, always face your load. I would slightly bend my knees because I can, and then I'd pull it up, and then once I had it in my grasp, I would keep it close to my body, because it's actually much less load bearing for you if you hold a thing close to your body. If you're holding the thing out there, your safe lifting load diminishes a lot, because that actually becomes in effect heavier for you. So if you hold it close to your body, it's a lot lighter in terms of the ergonomics and the leverage of the situation. So if something was down there on the ground and say it wasn't particularly heavy, how would you go about picking it up?
Well, I'd rather not bend over, so I tend to go down like that.
Yeah, which is great. So you're using your knees well, you're doing a nice squat, you're keeping your back in a pretty good alignment, and you know that the thing isn't too heavy, and you're coming up and then you're holding it close to you.
Yes.
That's exactly how I would recommend to do it.
Okay.
Yeah. Some of my patients here at Walper are getting over recent surgery. Sometimes they might have had surgery on both legs, but more typically they've had one knee or one hip operated on, if it's a lower limb surgery. And what they might do is put that leg behind, use their stronger leg in front, and use a lunge position to pick something up. So that's what the lunge will look like. Now, it's not quite as easy to maintain a good back position as if you could do a nice squat, as Deborah just did, but it's probably a lot safer for us to do that. This is the sort of lift I would not recommend, okay? Don't do this. What I wouldn't do is keep my legs straight and actually go down, hinging from the hips, because when I pick something up from that position, what's bringing me back up again, largely it's those extensors in my back. They're not designed for that. particularly not with the load. Yes, of course, I can go down and get something from there, but particularly if it's a heavy thing, and particularly if I'm doing it several times, that's dangerous. So I would recommend that no one does that. So you were just saying that on some days you would use different techniques depending on how you were feeling?
So on days that I'm not feeling particularly strong in my body or in my hands, I break it up into a 2-stage step. So that might look like bending down and picking up the bag onto a chair next to it or a table, and if I'm feeling well enough, then picking that up onto my shoulder, or if I'm then not feeling well enough, leaving it for a bit, sitting down, doing something else, and then coming back and then dealing with that, just to give my joints a bit of a break in between the steps of picking it up.
Yeah, because rest is important.
Yeah.
I guess, you might be thinking about alternatives. If this isn't for you, if carrying something on your shoulder isn't good for you, and there are lots of people who would prefer something different, maybe a shopping trolley could be the go for you, something with wheels. I've seen some that even have 3 little wheels, so that helps you guide the trolley upstairs. I think it's really a case of trying something out first and seeing how that feels for you. And also, what is your particular need and what is your area of vulnerability? For some people, pulling a trolley is fine. For other people, they've told me that when they're pulling the trolley, it's difficult because that twists their back. So a couple of people that I've spoken to recently have got trolleys that have 4 little wheels and a basket in the front, and what they're doing instead is pushing it, a bit like pushing a pram. And that's better because they're not twisting. So it really is important to work out what's good for you. A stronger person like Tom, who was speaking earlier, would be quite happy carrying a backpack. Again, he'll think about what is his safe lifting load. And that's important for all of us to think about, well, what's the safe lifting load for me in this situation? That has to do with how I'm feeling on the day, how far I've got to go, and how strong I am. And also, is the load close to me, or am I having to, for whatever reason, hold it out there? Maybe I'm picking up a very, very dirty dog that I don't want to hold against me. Well, let's hope I'm not. But I guess if I was going to do that routinely, then I'd probably want to get a really good apron so that I could hold the squirmy, dirty dog closer. I don't want to hold it out there and injure myself.